When you turn 65, you're eligible for Medicare. This is when many people make their first mistake. I run into this all the time because there's all these rules around Medicare and certain exceptions most people aren't aware of. Sometimes I can help after the fact, other times the mistake is permanent. A penalty can cost the person a lot of money over time. A new client of mine, Charlie, was really overpaying for his Medicare supplement, so I was able to save him about $400 a year with the same coverage but with a different company. We switched him out. During the course of our meeting, I discovered he didn't have a Medicare Part D prescription drug plan, and Charlie is 68, so 3 years without a Medicare Part D plan. He had worked with a big insurance agency out of Chicago. His company had recommended it. The Chicago agency didn't want to mess with the drug plan because it's a lot of work for very little, no money. As a consequence, Charlie ended up with a penalty permanently added to his monthly bill because he didn't have a Medicare prescription drug plan when he should have at 65. That is one of many examples I can mention. When you turn 65, usually you should enroll in Medicare unless you're on an employer health plan. Then you can defer enrolling in Medicare indefinitely without penalty. We'll just say that again because people have it fixed in their head they have to enroll in Medicare at 65. And there's lots of insurance agents who will tell you that because they want to make a sale or they're just incredibly ignorant. You can defer enrolling in Medicare without penalty and maintain your open enrollment status if you have an employer health plan. But there's always a but. Most of the time, Medicare is a much better deal for you. It's better in terms of overall cost. It's better in terms of coverage, not always, but most of the time. So what do you do? Well, there's 3 questions I generally like to ask people before going forward. First, are you working past 65? Now, if the answer is no, you're not working past 65, then that's real simple. Go and enroll in Medicare. You're going on Medicare. All right. If the answer is yes, I am working past 65, then we move on to question 2. Second, is there anyone else on your employer health insurance besides yourself? For example, a spouse, a child. Now, this is important. Can your spouse get health insurance somewhere other than through you? If the answer is no, your wife can only get health insurance through you, then you're done. Stay on your health insurance with your spouse and enroll in Part A, Medicare Part A only. Let me say it again, only enroll in Medicare Part A. Do not enroll in Part B. If the answer is yes, your spouse or your child can get health insurance somewhere other than through you, then we go to question 3. So you're working past 65, you do have an employer health plan. Most of the time, Medicare is better health coverage. So to compare apples to apples, we need 4 bits of information. How much is your monthly premium? What do you pay for your plan? How much is the deductible? Is it $1,000, $2,000? What's the co-insurance? Usually it's 80-20, but not always. How big is the maximum out-of-pocket, the most you would pay out-of-pocket for that plan? Once you have those numbers, we can compare Medicare to your employer health plan to determine which is the best coverage for you. Or the simplest, the easiest, the fastest way to get an answer to those questions is send us your phone number. We'll give you a call and figure out the answer for you in 5 minutes or less. In 5 minutes, you'll know exactly what to do. Now, if you're determined that you're going to enroll in Medicare, you have another question to think about, or questions. Which of the hundreds of Medicare plans and supplements is the best fit for you? In either case, click the orange button and find out what to do next.